in medicine, we're taught to go by the book, to follow guidelines, and that only has gotten us so far in helping patients. And there's so much more that we could do. There's so much that is broken about our healthcare system. And so we have to think creatively to find solutions.
Well, hello, everybody. Welcome back to the Dr. Drew Ramsey podcast. Here we are again working on mental health, building mental fitness, and I'm just thrilled to get to spend a little more time with you thinking about those ideas and those concepts. Today, we're going to get into gut health. We have a wonderful guest, a real superstar, one of the doc stars, one of the top 25 influencers when it comes to medicine and social media, Dr. Chiang, Austin Chiang. I just want to start saying he's like the perfect mix of super fun social media influencer, in my mind, Austin, just to start out here. You are an academic individual. You are at Thomas and Jefferson in Philadelphia. You are an advanced endoscopist. We're going to be talking all about that. And then also you're part of sort of tech and industry as the chief medical officer of Medtronic's Gastroenterology division. So this is why I'm really excited to talk to you, is this mix, because it's so often we have superstars in one of these fields, right? But it's very rare that we have someone who's kind of got a foot in all of these and really traveling through these worlds in a very interesting and nuanced way. So I'm going to post your full bio on my website. And with this episode, so everybody can reach. I mean, Austin has done so many great things, including founding president of the Association of Health for Healthcare Social Media. And so, Austin, welcome to the podcast. Thanks so much for joining us. How are you doing?
Thanks for having me. I'm doing great.
I failed to mention in your bio, you also are the author of a wonderful new book that I happen to get a copy of and have really been enjoying. My kids have been enjoying. It's the Body Literacy Library's book, The Gut and Owner's Guide. So, and you're about 6 weeks out from launch.
Yes. Yeah, it's been quite the journey putting this together and seeing it, out there in the world.
Yeah. Can you tell us a little bit how, when you think about the message for the book, you think about the message you want everybody to walk away from? There are going to be a lot of them, but what inspired you to write the book? What do we need to understand about the gut?
So this book is a colorful, illustrated guide to your gut, and I thought it was a great opportunity to debunk a lot of myths about gut health, to also showcase, some of the technologies and procedures that we do in gastroenterology, and really give everybody a little more insight into what it's like to, go into the gastroenterologist's office, to, what happens when you go into the hospital, what is it that the doctor's doing to you, and what is it that they're recommending to you. There's a lot of gut health books out there. A lot of them are focused on diet and don't really get into kind of the actual patient experience. And so this sheds a little more light on that.
That's so wonderful, because when we think gut, especially now, I think like microbiome, fiber, the idea of your view on the gut and really making our experience as patients, because something that's unique about gastroenterology, literally everybody is going to have a gastroenterologist, right?
Yeah, I mean, we all have gastrointestinal problems. If you ever had a bout of nausea or vomiting or diarrhea, I would say that you've had some sort of GI problem in the past. But it's so common, especially with how many organs are involved in this kind of system. It's not just the stomach, it's the esophagus and the liver and the pancreas and your colon. And there's just so much that's happening and so diverse that I felt it would be great to kind of have it all in one place.
It's such a great point, because when we think about the gut, we just think like, the intestines, the colon, and that's it. And your expertise is so much more than that. I suspect everybody listening, now I don't know, this is probably the first time you've spoken with an advanced endoscopist, to the point that I think a lot of people might not know exactly what that is. Can you tell everyone about that, your training, and what it is that you actually do?
Yeah, so, like a lot of other medical specialties, things are becoming so specialized now, even within those specialties. And so after going through training to become a gastroenterologist, you can go through additional training to go through different paths. And one of those paths is actually called advanced endoscopy. And it's basically centered around more complex procedures, often dealing with the pancreas, with the bile duct. And also nowadays, there's areas within that where we can do more complex procedures like carve out tumors, early tumors, or we can help people lose weight by suturing the stomach down to reduce its size and turn it into the shape of a sleeve, and interesting procedures like that. So very highly procedural part of gastroenterology.
Is that because you were particularly adept technically and really good at sort of with endoscopy? You're using a lot of new, very advanced tools and scopes and devices that I think a lot of people aren't used to seeing.
Yeah, I like to think that I'm pretty good at it, but I also think that it's just a personal interest in the gadgets and technologies that we have in that area, and the fact that a lot of our field is built on taking more complex, more invasive surgeries and making them less invasive and less risky, and that's why these procedures that are endoscopic, which means done through the mouth, are a whole different way of approaching things.
So you'll access things like my pancreas going through my mouth or my gallbladder, as opposed to back, maybe 20 years ago, where you have to sort of have a more open surgery. That's a much bigger recovery time and much riskier.
Yeah, absolutely. There's definitely specific procedures that we do nowadays that are standard of care, that if you were to rewind 20 years ago, for instance, they were done open, surgically, and that would come with much higher risk, much worse outcomes. And so it's nice that we're able to offer some of these novel procedures to patients.
Well, you talked about some of the symptoms that we're all going to have in our life, and I was thinking that we all have a gastroenterologist because we all get a colonoscopy. Hopefully,
That's
is
true
it now? I
too.
think 45. I think is what we're shooting for with everybody listening. That have you had a colonoscopy or not? Just kind of a simple question, and I think a lot of people avoid them for all kinds of reasons that really.
Sure.
I don't think you should. Happy to talk about it, but it's a great. Very helpful procedure, I found, in terms of both, that question you have as you're aging of, are there things I can do to better take care of my health preventatively? Are there other reasons people should see a gastroenterologist, or some of the common things you see where, as a gastroenterologist, you get a little frustrated, like people hold off on seeing you all for too long?
Yeah, well, first of all, you're absolutely right. Starting at age 45, if you're average risk, meaning if you don't have any family history or if you don't have any specific underlying conditions that predispose you to developing colorectal cancer, everybody out there should be getting screened for colorectal cancer. And usually that means getting a colonoscopy. And the reason why we recommend a colonoscopy versus some of the other kind of non-invasive tests or stool tests is because we're able to locate precancerous things early and remove them on the spot. So that's the benefit of undergoing a colonoscopy. And it's from what I'm told, and I've actually had one done before myself, but I'd say that most people come out of it saying that it's the best nap of their life. But yes, I would say that, on top of that, there are other reasons why you should go see a gastroenterologist. Other common symptoms, especially symptoms that don't go away or continue to recur over and over, like the nausea and the vomiting. Sometimes we also brush off things like blood in the stool. Often people feel like, oh, it could just be hemorrhoids, or they make assumptions that, it's not as bad as it could be. But it's always better to be safe than sorry and to get it checked out, because certain things, when you describe it to us, can ring alarm bells, and we may want to, take a closer look, either through a scope or some sort of testing, to just make sure that nothing more serious is brewing.
That's great. I also feels like a lot of illnesses in your field. Like I've seen some statistics that up to half of people with like celiac disease are undiagnosed, and a variety of other conditions that I kind of wonder. Not to call you a conventional cardiologist, because as I said earlier, I think about you as gastroenterologist. I think about you as a very special gastroenterologist, but you're certainly on the, I would say, conventional end of things. And I'm wondering if some of the ways that your field gets viewed these days through the eyes or lens of gluten, or how integrative medicine really has a lot to say about the gut. There are a lot of, colonics and probiotics and fiber pills that everybody's telling your patients to take. I'm just wondering how you can help everybody listening maybe better navigate that.
Yeah, I think that it's all a spectrum. There's definitely things that could be helpful. We just don't have enough evidence for at the moment. There's definitely things that are just straight up harmful and that we would recommend against. So I would always advise speaking to, a trained professional about, kind of where those options lie on the spectrum. And, it's not always black or white. I think that there are times where there is a lot of nuance to it, but you're right. There's certain conditions that we often ignore, like acid reflux, that seemingly in the short term doesn't matter so much, but over time can become concerning. And we kind of take that into account when we're thinking about certain remedies or treatments. We kind of have to weigh it against what the risks of the condition that we're treating are, where it's headed, and what other treatment options there are available. So it's all very much a discussion, and it should be a partnership kind of with your doctor in making those decisions together.
It seems like there's so much irritable bowel syndrome and IBS these days, and a lot of maybe alternative solutions to that. And I was wondering some of the basics. You mentioned earlier, the things that, would be bad that you'd never want people to do for the gut. And I wonder if there are a couple of like the things you really want us all to pay better attention to and avoid, and a couple of things that you really think that are great for the gut that we all need to be doing more of. And I know it's hard to make kind of broad recommendations like that, but I was wondering what comes to mind.
Well, I mean, I think for something like IBS, some of these, some of the most challenging, or sorry, some of the most common conditions out there, like IBS, are some of the most challenging to diagnose and treat. And IBS is one of those conditions that you kind of have to rule out everything else that's serious before you come to the diagnosis, which is kind of unfortunate because I wish we had a test that could just straight up tell us that that was the issue. But yeah, I think that there are certain things that we could do to help our gut, just broadly speaking, like you said. Generally speaking, having a diverse, high fiber diet is a great start because you're really getting all the nutritional benefits across the entire gamut of foods that you're eating, and you're not just only confined to one category of foods. And high fiber because we want to have healthy stools. We also want to keep things moving along. And then some things are pretty common sense at this point, like avoiding certain things like smoking and alcohol can really significantly reduce your risk of certain types of cancers too. So, just adopting those healthy habits in general, I think will go a long way.
Austin, do you have some favorite fiber foods? I created this, I'm getting old, and so I'm worried I'll just be forgotten. And they told me I should name something after myself, like the Beck Depression Inventory, which I used to think sounds grandiose. But so I've created the Ramsey Big Five nutritional psychiatry self-assessment, which is maybe a little bit of a silly joke. But I put up this slide where I ask everybody their 3 favorite fiber foods. And I'm wondering, one, what are your favorite fiber foods? And can you tell us, are there different types of fiber that we're supposed to be going after in some way that we should pay more attention to?
Yeah, I think that, soluble fiber is the kind of fiber that sort of gets dissolved in water and can help move things along. It really depends on like what you're trying to achieve with fiber. If you have it's always a balance with water. And if you have too much water, then your stools can become too loose or more loose, I should say. And then if you don't have enough, then it can really bulk it up, in which what some people need that to effectively go to the bathroom. I don't know, some high fiber foods, I'd say, I mean, there have been studies that actually looked at, how effective some of these foods are for certain conditions and for like constipation, for instance, specifically kiwis. There was a study looking at that and showing that if you were to eat 2 kiwis, versus a standard control group diet, then you have smoother, more frequent stools, and so that might be a solution.
Is there something special in the kiwi, like that they were after? Is it a particularly high fiber fruit, or what? Why kiwi?
I think it was mostly fiber, but I feel like the tricky thing about some of these fruits and vegetables, I would say, is that there are also other substances that can may potentially make you go. And and that can be irritating to some people. With irritable bowel syndrome, it can sometimes make your bloating worse. And I feel like some of these foods are notorious for that. Whether it's Brussels sprouts or cherries or something like that. So you do have to kind of go through a little bit of trial and error to see what's best for you. And the good thing is that there are a lot of options out there.
There are lots and lots of fun and great fibrous foods. That's certainly true. I was wondering, when you think about your diet, if we can ask a little bit, as you're traveling around a lot, is there a way that you kind of keep track of fiber or keep yourself eating enough plants?
It's so hard, especially when you're on the road and you're not preparing your own food all the time and you're eating out. I, try to have a balanced diet. And so my go-to that I often talk about is just getting a poke bowl, because I feel like you've got, at least for me, I like the fish and the vegetables and whatnot. And I know that maybe some listeners are plant-based, and so you can definitely substitute your protein with tofu or something like that. But it gives you the ability to kind of customize, what vegetables are going in, and I always, try to get a good mixture of things there. So whether it's the seaweed salad and the zucchini noodles and the edamame, I think I try to go with that, but it is tough, and that's why sometimes I do have to take a fiber supplement.
That's also, I appreciate you sharing that, and I think it's something that some people need, and also I think a lot of times with supplementation, we're kind of like pro or against, as opposed to there are different situations. If you're traveling all over and you're in a situation where you're not really getting as many plants as you'd like to, but it's just not happening. You're at a bunch of conferences, etc. Yeah, I can appreciate it's good for people to. Is there a fiber supplement that does everybody still recommend Metamucil? I feel like when I was, still in hospitals and occasionally having to give people things for or Colace, or what's the kind of standard fiber supplement these days that people would take if they needed one?
Typically, I would say psyllium husk. So Metamucil is a brand of that, although there's also a lot of generic brands out there. It doesn't have to be Metamucil. And, I think Colace is a stool softener, but there's a debate as to whether or not it truly helps with softening stool. So, it's hard to say. And I would say, the reason why fiber is so great is because with a supplement, it's still fiber versus some other medications, some other laxatives out there are actually medications that stimulate the gut. And long term, it's not a great idea to take some of those, because sometimes your gut gets used to, being reliant on those medications, and that's not a good thing. So, fiber, if you're able to and it helps, then I would stick to that.
All right, that's helpful, and it sounds like a mix of. I'm hearing here. Think about our water intake. Think about our plant and a diverse set of plants intake, and maybe a couple of special things like kiwis help out a lot. And then I think
and physical activity.
Move around, keep it moving.
Moving around.
That's definitely, I think, always something that I think it's hard for people when they're a little constipated, right? You feel like just I don't know, not being very active. It's always important to keep moving up. So you were just at a really one of the largest gastroenterology conferences, and I'm wondering if you could share with us some of the exciting stuff that you saw. Again, a lot of times in gastroenterology, I think particularly for our community and everyone listening in the brain food world, we think microbiome and fermented foods, and I want to hear your thoughts on those. But you're in part of the GI world that's really exciting, and I'm curious, what's got you stoked?
I'm a little biased because I'm focused a lot on the technology side of things. I know there's a lot of work happening on the diet side, and just even walking through the exhibit halls, there's a lot of companies focused on dietary supplements and ways to impact certain conditions through diet. But I think for me personally, I'm very interested in the intersection between artificial intelligence and gastroenterology, just like so many other, fields, even outside of healthcare, are being impacted by AI these days. And, there's an opportunity for AI to help doctors be better at what they do in terms of diagnosis or treatment even. and also more efficient. I think that that's one key thing, is that many people have probably heard about how a lot of doctors are struggling with burnout, and how it's become frustrating in a lot of ways to practice medicine because it's become very administrative. And so there are ways maybe that artificial intelligence can speed the process along, can allow us to see more patients with less administrative, burden. And so I'm looking forward to seeing where all that goes. And AI is already here in some ways, because there's already, an AI assisted colonoscopy tool to help doctors detect polyps a little better. So, for people out there who are looking for a colonoscopy, looking to get a colonoscopy, there are, certain devices out there that can help.
Wow, that's so. As the colonoscopy is happening, AI is kind of watching along and saying, actually, maybe go back a little bit. That looked a little suspicious to me, kind of thing. Sort of co-piloting.
Yeah, it can exactly, like co-piloting. It can point out, things that potentially would have been missed. And there have been studies that have shown that it actually does increase detection.
Wow. It sounds like, and the efficiency, we hear a lot of promise of, we're not going to have to write notes anymore. I think if you look at burnout factors, doctors tend to, sort of say the electronic medical record. Are there things coming down the pike with AI? I mean, a lot of times maybe we're nervous about it, but I'm wondering, did you see anything that really maybe surprised you in terms of what's happening in gastroenterology and the kind of next frontier of things?
I mean, I think that there's just so many applications to artificial intelligence, and I feel like the way we often think about it in our field is how it can help with a certain image, right? Like kind of that colonoscopy example. But even outside of the device space and the technology side, AI is being used to help predict the next new medication out there that could help, people out. It could make that process a little more easy. It's here to also potentially provide therapy, in the sense that outside, a lot of the care that happens doesn't happen in the hospital, right? It happens when you're at home. And so if there's a way for AI to help out with that, whether it's through some sort of chatbot mechanism, that could be helpful too. Especially because so much of the gut is related to the mind, and how behavioral therapy is, a key part of treatment oftentimes. So yeah, I see it going in so many different directions, and I feel like we're only at the very beginning of this whole movement.
A lot of people listening, and it's a lot of people in healthcare, don't really know what to do to start experimenting or using. How do you go from not using AI really at all to starting to do something interesting with it?
Yeah, I think like any other technology that's introduced into medicine, there needs to be data, and there needs to be enough evidence to back it up to convince people that, hey, there is actual clinical benefit here. We're not just going to pick something up. We're not going to pick up a new technique or procedure or device or medication without the data to back it up and say that it actually will help people and not harm people. So I think that that's really what it comes down to, is having the evidence and then providing education around it. And, I feel like healthcare, like in many other things, is slower to adopt technologies. And so we kind of have to, now is an opportunity, I think, to get ahead of it and try to incorporate it into, our education programs, our training programs, so the next generation of doctors can really hit the ground running. But yeah, I think that we have a lot of work to do.
Do you recommend people who aren't familiar with AI start by taking some classes or getting interacting with one of the various Chat GPT, Llama, Bard, various platforms, or is there a way that you think is fruitful in terms of people starting to learn more about it?
I think if anyone learns the way I do, I think it's just trying it out and seeing seeing what it's all about yourself, and not necessarily having to take a class. I feel like a lot of these systems are publicly available, and you just got to dive in and do a lot of trial and error. I feel like,
What did you start asking?
I tried out ChatGPT and, tried to type in some prompts and ask certain questions and see what it would spit out. But at the same time, AI has been around us for a very long time. Like, we often talk about AI like, oh, it's something new in the past year or two. But really, we've been living with elements of AI for so long. If you think about, Google Maps or navigation or, social media and how it predicts what shows up on your feed. Like these are all forms of AI, and AI is affecting us outside of healthcare in so many ways. There's this whole movement towards autonomous, driving cars, right? And that's reliant on AI. So, I know that there's a lot of hesitation around it, but there's also a lot of opportunity. And I am excited about how, not only will it make doctors do their job better potentially, or help speed up the process with certain things, but it might also help like personalize our approach to patients. Like if we can actually take all the inputs, your medical history, your demographic information, and put that all into whatever it is you're going through right now, it could help inform doctors in a way that personalizes your experience a lot more rather than just a one size fits all approach based on the algorithms that we're taught, in our scientific guidelines. So I feel like we're at the cusp of a whole new era here.
Yeah, it's great to hear that perspective. I hadn't really thought in that way that AI has been around for a long time. It does feel like suddenly, 18 months ago, it arrived. Is that in part because we just got more access as the public that, as you said, we can dive in and start to experiment a little bit and ask some questions and learn about prompts?
Yeah, I think it's become more apparent maybe because a lot of the big, companies with big presences are talking about it now and are developing things, in their own ways for it. And, I feel like the reason why we're able to actually see some tangible outputs, in healthcare and whatnot is because finally the computing power is there that we can actually have meaningful AI. Previously our computers were just not powerful enough to be running these things real time, and now they're able to, which is pretty cool.
And it's about how quickly it's gotten to the public. If it's it's a sudden shift in our ability to access it really over the last little bit. Maybe it's a strange transition because it's not quite as exciting or cutting edge. But there are a couple of things that I've noted following you on Instagram, and I'm just curious if you can share and help everybody listening a little bit with some of your wisdom. For example, I noticed you travel a lot for business. I saw one of your posts of how many days you've been on the road and how many different hotel rooms you've been sleeping in. And I think for everybody who travels or maybe struggles with some loneliness or isolation, I was wondering if you can share with us some of what, your protocol of how you deal with being on the road and traveling, but particularly like feelings of loneliness if those happen.
Yeah, I think that's a really great question. Obviously, mental health is very important to you and everyone listening here. I feel that it really depends on the individual, right? I consider myself to be someone who's more introverted, and despite what it appears like online, but there are moments where it kind of is nice to be by myself, and I travel and I do the things I do when I'm going to travel for work because it's fun, and I'm very fortunate to be able to do that. I think that if it was such a slog that if I had to go travel and do things I didn't enjoy, that it would really take an even greater toll on me. But yeah, I think physically it's a lot, but I think mentally it's actually nice because I'm enjoying what I do. But to your point about feeling lonely, there are moments where I think about, okay, I should really be spending more time at home with with a stable social group. And there are other times where, very fortunately, I have friends in different cities and I have a chance to catch up with them and I take advantage of those opportunities. But that's also the way I process things, right? I know that that's not necessarily the way everyone processes their emotions. And I really like just talking things out with friends. And, as much of an introvert as I am, I think when I'm with close friends, I really like to just talk things out. And so whenever I'm in a city, even if I'm not in even if I don't know anyone there, it's nice. I know that I have people I can call or, just have a chat with and not feel so lonely all the time. So I'm very lucky to be able to have that.
I gotta agree. It sounds like I love how you're sort of challenging some of those biases about quote unquote introversion. Because I think a lot of times we say it's like, oh, that means you're quiet, you don't like people, or something like that, or people stress. And I love how you clarify that actually you still love to verbally process it. It's just with not, with a few people. Because I think that's true even, for extroverted folks. Like if you're trying to process some of your feelings or complicated feelings in a group or getting that sort of extroverted attention, it doesn't work very well. These are usually quieter conversations that are helpful to us, especially when it's about maybe feelings or our mental health. So I really like that clarification a lot, and also as you note that traveling can be really fun. You get a little time alone, and hotel room. You get to see. It sounds like you do a good job of planning ahead. That if you're going to see people, trying to get that on the calendar, and if there's maybe folks you don't know or you're staying in to at least maybe be active and have a phone call or FaceTime with somebody that is in your closer circle.
I try to at least.
That's good. They're good goals. Well, thanks for that. I've been really curious about your work with Medtronic, and I don't know, how much you're allowed to share, but I just think it's so fun. In part, industry is sort of different than pharma, I guess, in the sense of there's so much technology and advancement, and I've gotten to work. A few of my patients have been Da Vinci robot experts and surgeons, and it's just fascinating to see what you all are doing. How do you have this fun role at Medtronic?
Well, this actually was a bit of a surprise to me when I first was approached. I had no real intentions of making the transition into a medical device, job, and was called by my former boss and basically asked on the spot if I'd consider a role as the first chief medical officer for the endoscopy business. And, I thought to myself, wow, well, this type of opportunity doesn't come by very often, especially usually not to someone at this stage in my career, someone who's relatively junior. And I think, at the time I thought it'd be a great opportunity to, really dive into the innovation process and understand how you take a concept to market and get a look behind the curtain, because I think for so long physicians were left out of that whole process. And so, yeah, I agreed to do it, but I said I would only do it only if I could continue practicing part time and keep my hands active and be able to speak to what I'm doing and remain credible. And I was able to arrange that, and it's been great. It's been a lot to juggle, but it's been very fulfilling, and I feel obligated as really one of very very few gastroenterologists in the medical device space to share what I'm learning with my greater GI community, because I think there are a lot of creative people in my field, and a lot of them are wanting to contribute and wanting to innovate. And there are ways to do that in different realms, whether it's in academia or in other ways. But to actually come up with something that's going to eventually be commercialized to an entire country or around the world is a rare opportunity, and we have the ability to do that.
Will you talk to us a little bit about creativity? You're such a creative person, and it's so exciting to hear in some ways like the invitation to doctors and engineers and fields that, again, sometimes we have this bias. We don't think about them as creative fields. You don't think about gastroenterology or advanced endoscopy as like you're an artist. But, there's a tremendous amount of creativity going on with what you do. Can you tell us a little bit about like how do you foster that or honor that or
Yeah,
have more creativity?
I mean, absolutely. I mean, I think you're absolutely right that in medicine we're taught to go by the book, to follow guidelines, and that only has gotten us so far in helping patients. And there's so much more that we could do. There's so much that is broken about our healthcare system, and there's still people out there suffering. And so we have to think creatively to find solutions, in those areas. And I feel like for me, one of those solutions is just education and access to accurate information. And that's why I put myself out there on social media. And it just so happens that that outlet is also a creative outlet where it's not only a creative solution, but it's a creative outlet to kind of express myself and do something fun and humanize the profession so that not everybody feels that we're all intimidating and unapproachable in medicine. Because I feel like that's the common assumption, right? Is that here are these doctors in white coats who are difficult to approach, and and we kind of want to break down those barriers so that it brings us closer to our patients. So I feel like there's so many ways to be creative. My own way, on top of contributing to the medical device space, is also on social media, and I feel like there are others who have a story to tell, who want to express themselves in different ways, and I feel like all those viewpoints are important.
Can you tell us a little bit about those early days of social media? I mean, had you always? I'm trying to think of before social media. I don't know whether you're dancing in public and being creative and expressing yourself in that way. Maybe you were, but I'm kind of wondering about that. Some of those first steps, and if you can share a little bit about, I guess, finding confidence and how you thought about going from being somebody who's not dancing in public and being really fun and creative that way to being out there like that.
It was definitely a stepwise transition over the span of a decade. And so I started out on Twitter, and it was very much text-based. And at the time, I was actually in training still, so I definitely didn't feel 100% comfortable putting myself out there as an authority. But I talked about what I was learning and sharing that online, through the lens of somebody who was going through training. And gradually, as time went on and all the different platforms started showing up, I got on each platform one by one. And as everybody probably knows, every platform has a different kind of culture and identity to it, and so I would adapt to that, because I feel like I was trying to teach myself different ways of reaching different audiences, and through that, I gradually became comfortable going from text to images on Instagram, and then trying to, film myself for YouTube. And TikTok came along and infused a whole nother element of humor and fun to it. And I just, I remember very, very early on when I was on TikTok in 2019. I think that was before most people got on TikTok, and most doctors, I would say. And I started, sort of using these trends to talk about, kind of putting a medical spin on them. And I feel like at the time, these trends were very obvious. Like, now it's a little more diluted, but the community was tighter back then. And I think that people could appreciate kind of what I was going after. And I thought it was a fun way to package medical information, because ultimately, I think I'm not only trying to reach people who are seeking that sort of information, I'm trying to reach people who don't know that they even need that information. A lot of the people out there, like what we were talking about earlier, everyone needs to get a colonoscopy at age 45. A lot of people out there don't even know that that's not even on their radar. And so how do you package it in a way that the information will get to them unknowingly, and not have it be something off-putting or boring? Because there's a lot of data that we can throw at people, and charts and graphs, but what, at the end of the day, if it's packaged in a fun way, people might remember it, and not have to deal with a boring way of learning.
No, it's a really great way to think about social. This PSA that gets out to people who really have never heard of a colonoscopy, as you say, or have not thought about they need to to check out their chronic constipation. And that you can reach them by picking up on the trends. It's sort of like almost little Trojan horse of PSA, but it's great. Yeah, that adaptation it's really an interesting thing to see people go through. And I remember you making that transition to TikTok early on, so it was fun to see. I want to get back just to food and mental health, because I always like thinking about mental fitness. And we went through your training, I would say somewhat, I wouldn't say quickly, but maybe everyone listening, it's not as clear, but before we even started fellowship, you're at 10 years, I guess 14 if you count college, but 4 of medical school, 3 of an internal medicine residency, 3 of a GI fellowship, and then I would say, was it a year or 2 years of advanced endoscopy? So a lot of training. And I'm wondering if you can talk to us a little bit about maybe mental health or mental health role models or frameworks that have been helpful for you as you think about taking care of your mental health through, all that stress and all that training.
Yeah, I would say, everyone has a different model that they look up to or a different way of approaching their mental health. I think for me, it's interesting. Aside from the people around me who were going through the same exact thing as I was through training, I would say that I always thought, and I tell students and trainees this all the time, that when going through difficult times in medical school and residency, I would think about all the people who had gotten through this before me. And so it wasn't like a specific person, but I thought to myself that I could do it too, just that, other people have gotten through it. And I get that, sometimes it's hard to put things in perspective. I definitely, I make it probably sound a lot easier than it really was. There were moments that were pretty difficult, but that is something that I use to kind of remind myself constantly. And I'd say, like the way I process, hardship and stressful times, as I mentioned earlier, was talking things out. And I'm really grateful for friends and family for being an ear and a shoulder to cry on. And I always felt comfortable doing that. I know not everybody is kind of comfortable with bearing their soul to somebody.
Are you just naturally, I wasn't naturally good at that, but that's always been comfortable for you? Or is it something that you learned something about that made it easier?
I want to say that it was natural, not that it was innate necessarily, but maybe out of necessity. I grew up an only child, and I felt like my parents were, they were parents, so they were pushing me along, and I didn't always feel comfortable going to them with my issues. And so I leaned a lot on my friends, and I think that that's how this all came about, and how, perhaps the friends I ended up being closest with were those who would actually spend the time to listen to me and give me feedback. And the ones who weren't so open to that, maybe I, didn't become as close friends with. So,
I love this point. I think this doesn't get emphasized enough because it's always about like be vulnerable, open, share your feelings, find words for them. And, that's all important stuff. But I love your point, which is like find people in your circle who are actually good listeners.
Yeah. People, I think that I've heard somewhere before that, you have friends for different reasons. And there's some friends that you go out with, or friends that you have intellectual conversations with, and then there are the friends who are there to support you too. And not every friend has to serve that, doesn't have to be kind of well-rounded. You can go to different friends for different reasons.
It's a really good point. I've not done I'm still working on this one in my own life, but it's a really good point. I have a couple of friends out here. One in particular, I'm thinking about a great friend named Brenda. He's just an incredible mountain, probably the best mountain man I know. But I was out with him in the mountains, out snowboarding. I remember sitting with him on the chairlift, and I had this weird feeling. I'm so used to connecting to people around their emotional pain. Mm-hmm. And I was sitting there really, and so I was having a hard time just being with him. It was such a meaningful time to be with him. We're having such a great time together. But I felt this, my way of connecting and really like being close is, as you're just describing, kind of this very verbal processing way. And some people are like that, and some people aren't. And sort of recognizing, that way so often with other people, we don't necessarily connect verbally. We go to a movie with them, or we're fans of something together. And I think it's really great to acknowledge that and sort of, honor those attributes in our friends. We're not just good listeners who keep us supported.
Exactly. I mean, we're all very multifaceted, right? We're not just here for one purpose. I feel like everyone has a lot to bring to the table. And there's some people who I naturally gravitate toward in certain situations because they shared a certain experience or a similar experience that I can kind of lean into, and then others for other reasons. So I don't think it has to be, always one way or another. It all is very dependent on the situation.
Also, I wonder how in your mind do you keep social media a healthy thing in your life? Like,
Ooh,
where's the kind of boundary for you? Because so often I'm on social media, sharing about mental health, saying social media is bad for mental health, and so I'm wondering, how do you define that in your own life?
that's a really great question. It also depends on what reasons people are on social media and kind of where they're at in their journey. I feel I've been doing this for so long, and I feel like I have gotten to a point where I don't feel compelled to have to create every single moment or engage every single moment. So I do it when it's fun, which happens to be a lot of the time, which is why I continue doing it after so long. If it wasn't fun, I wouldn't be doing it. But there are definitely moments where I have to detach. And just one example, I used to for years post on TikTok maybe even twice a day or even like
Mm-hmm.
every day. I can't even remember the last time I posted on TikTok. I want to say maybe 2, 3 weeks ago.
Huh.
And I'm conscious of that, but I also tell myself like I don't need to force myself to make something because I feel like that's just gonna be unhealthy.
So it feels kind of like a natural motivation to you. And is that partly, now that as you're traveling, you're with Medtronic, you've kind of had a period of maybe dancing on TikTok, that's a little less where you are, and you're a little more in, maybe thinking about some other platforms, or uh, you just kind of, it sounds like following, I don't mean to make a pun here, but following your gut a little bit on, you keep it healthy because if you don't feel intrinsically motivated, you pay very close attention to that. You don't engage just for frequency, following, etc.
Yeah, exactly. I don't pay attention to the vanity metrics of it all. And I also feel like, for me at least, I'm sure there are a lot of people on social media who use social media to follow influencers and follow, these strangers who often have, a very different lifestyle or whatnot. And luckily for me, I'd say a lot of the people I know on social media or follow on social media happen to be people I personally know or have become friends with and I've gotten to meet in
Hmm.
person. So I really feel like it's an extension of my life and it complements it well versus something that's so foreign and just, is creating this image of what life should be like. But again, I think that I still, despite all my activity on social media, prefer to interact with somebody in person. I feel like there's something to be said about, that in-person connection that you just don't get through anything virtual, really, even if it's text or FaceTime.
I think you did a great job of modeling that, of making sure, especially more over the last, since the pandemic, of just seeing you out about it. It's clearly that, again, I love how you let us know you're introverted. Let us know that you also get charged up by people, and that sharing stuff and verbalize. I just think it's really healthy, because so often those ways of defining ourselves, or the ways that people define us, I think they come with a set of biases. Like, it reminds me of this the Amend trial that came out about changing the diet of young depressed men. And we
Mm,
instantly think that's not a great academic place to focus, because the boys aren't going to come to the research trial. They're not going to
yeah.
engage, and they're certainly not going to change their food, because they're just eating like burgers so their biceps can be big like Joe Rogan's, right? And that's not at all what happened in the trial. We see a really big shift in how a lot of young men are approaching food, especially men with depression. That's what we see in our clinic. But it reminds me of the kind of inherent biases we have about a lot of things that, yeah, I appreciate that you're sharing so much about how you take care of your mental health, how you take care of a really engaged community, and how you balance and use social media in a way that it feels like promotes your connections. That you both have a very engaged audience that, I feel cheering for you in a certain way. That's how I feel. At the same time,
Oh, thanks.
it's just really yeah, it's fun to see you use it in a healthy way, to be creative, but to not have it, take over in a way that we so often worry about.
Yeah, I appreciate that. I mean, there are definitely moments where I also am concerned about what I'm putting forth and how I'm portraying myself because, I really only post when I feel good and when I'm happy and I wonder if I'm giving people the sense that that's how life is always, for me. And I try to be mindful about that too. So
I've been wondering about that. I've been really wondering as a psychiatrist and as a person who I mostly see patients here, on Zoom or on that couch. I've wondered about that myself. I had a moment last summer. I was interviewing Carl Radke, who'd been part of these reality shows and had lost a brother to overdose, I believe, and I hadn't known that about him. I'd kind of wondered, like, what am I doing interviewing this reality show guy? And I started, and I burst into tears.
wow.
I remember I made a reel, and I sat and I was like, do I post this? And it's kind of like about how mental health is really hard. We talk about it, and it's awesome how open we are, but just sometimes just so hard. We're talking about so much pain and so much loss, and I think the thing that's horrible about mental illness is often so much confusion. Like, what is this? Will it get better? What's wrong? So, and I never posted it because it just felt like middle-aged white men crying on the internet is not. I don't think gonna. I don't know what I was worried about. I guess maybe people being concerned. I don't know, but yeah, it's like post the lentils, not the fried chicken. It feels like, and French fries. Do you think we should post more of that stuff? Like, show the, I mean, because I actually think about you some of these pretty like sad stuff, but I feel like there's a nice range when things are stressful or overwhelming. I feel like you're sharing about that sometimes.
Yeah, I think sometimes it can be healthy. I'm careful with what I post because I know that a lot of patients follow me, and I also am very mindful about, like, I don't want there to be a perception of my emotions getting in the way of how I do my job, etc.
Right, that's the one I worry about. People are like, "What? Boy, if you're so
Yeah,
upset,
are you
what do you know
okay?
about
Are
it?"
you able
Yeah,
to?
like, sure, you're a feelings doctor. You look like a mess, and
Yeah,
it's patients who follow you, and then some patients' parents, particularly moms, whereas like, just I don't know. That's a little part of my super ego where I don't know why. I just want to. Yeah, it's that challenge, right? How do we not present the best of ourselves all the time and be
right.
authentic,
Mhm.
and at the same time, because I also think that's important for burnout and for our profession, right? Being physicians, we're in this profession that is filled with healers who burn out and then die by suicide. I mean, it's the top profession, I wouldn't say by far, but, along with farmers, we're definitely leading the pack. And so there is something about how we're not, we make it like, how is it? Being professional, bless you, being professional is not sharing our emotions is often what it comes down to. And, and as you know, that's like so important for us.
Yeah, absolutely. Yeah, I think it's, there's an element that we do still need to be vulnerable and still be real. I mean, that's part of how I maintain some authenticity online to people who are interested in what I have to say. But yeah, it's a difficult juggling act.
And also, maybe that's the difference between the very, very emotional post, which is, as you know, that's great for some people and works for their platforms, but for people who may be a little concerned, maybe at least even in conversations like this or another post, just acknowledging there's more to it than that, which
Yeah.
I do feel I'm seeing out of a lot of folks in our profession. Can you talk a little bit for all the healthcare providers listening around your work in social media and your association, a little bit how people can get involved?
Yeah, I no longer lead this association, but this all came about a couple years ago because we were concerned about, you know, um, a lot of misinformation out there, and we wanted to empower other health professionals to get online and not only use social media effectively, but also responsibly, because many of us who founded the organization have learned the hard way and have, been fallen victim to a lot of the pitfalls of being on social media. But with with that said, we had those lessons learned that we could share with everyone. And really, it's interesting because that effort came together before the pandemic, and during the pandemic was when the social platforms took an interest because suddenly they were faced with all of the accusations of misinformation being propagated on their platforms. So they started working with us and helping, remind us and put on courses about, things that we should be paying attention to when we're creating content, not just the content itself, but also the setup. You're lighting and your audio and all those, fun things. And so it became a really fun effort, and we really wanted to try to be a kind of professional society and legitimize what we were doing here by giving out mini scientific grants for research around social media and healthcare that was funded by Cochrane Collaborations. And so yeah, I still continue to be involved with some of the platforms directly and help advise them from time to time. But now, the beauty of social media is that many of us who are on those platforms are there because we want to help. We're there because we want to have a conversation. And if you reach out to any of us, really, we want to help advise our colleagues on how to be successful on social media and be a beacon of accurate information. And that's really what it's all about.
Well, it's just wonderful work, and it was really well timed to get the organization started. And it's been fun to see so many of our, colleagues and friends on social. Up level, really raise the level of information in terms of how engaging the content is, but also what I always hope for social, especially early on, having started in Twitter, 2010, a long time ago. It was just this idea that there would be more highly credentialed professionals putting out information, so there was something to battle all the misinformation. And it's just been really fun to see you be a part of that. In a particular doc star in that it was really fun to see you as one of the most influential folks in social. I think it was in healthcare recently, and so that was just a treat for all of us. I've watched you rise, and what a great conversation, everybody. AI, creativity. I feel like we skipped over your book, which I'm going to hold up again. Everyone, check this out. It's really interesting because it's not like the other gut books out there. Right? All the other gut books right now, not all of them, but most of them are really focused on diet, on the microbiome. There's some of that info, but what I really like is also mentioned is the book is about how to navigate the new complex world of GI, which isn't just about our intestines and digestion. It's about our pancreas and gallbladder. There's so much new technology. Austin, thank goodness for all of us who have worries about what's going to happen to our systems, that we've got great doctors like Austin Chiang, who's leading up Medtronic's GI endoscopy division, and also if you're in Philadelphia, seeing lots of patients at Thomas Jefferson, and of course, check out his social media feeds. Austin, what's your website? And we'll put all this up on the show notes, but just so people can hear it now so they can find you.
Yeah, my website is austinchang.com, and my handle is the same across all platforms, which is Austin Chiang MD.
All right. Well, keep shining bright. What a treat to hear about your creative process and about how staying healthy as you're traveling all around. And I'm very grateful for all the work that you're doing on all these platforms, and the positivity and the creativity and the inspiration you bring to all of us, Austin. So thank you so much. Thanks for coming onto the podcast. Would you just leave us with a final thought? I always ask everybody for a final thought, a mental health mantra, something that you use on your weekends as people hear this and are headed into a little time for themselves. Is there something you'd like us to be pondering to improve our mental fitness?
Well, first of all, thanks for having me on. I don't know if I have a special mental fitness tip, but I would say, just be kind to one another and remember that, what you see on the surface isn't always what's happening, not entirely the full picture. And I always try to keep that in mind whenever I'm communicating with anyone, because we're all going through something, right? And it's nice to just keep that in the back of your mind when you're out there navigating the world.
Well, it's such a wonderful piece of advice, and also maybe nice to come full circle as we think about how you travel in all these worlds so well. I wonder if there's a way that in a lot of different settings, you bring something to the conversations, into the rooms around having a sense that, there's a lot going on for people. And being able to, I wonder if there's a part, it struck me what you were talking about earlier was really very beautiful. Thinking about you in the midst of maybe struggling in residency like so many of us did, and instead of getting angry at the system, which so many of us did, you thought about all the people who came before you.
Mm-hmm.
and that you weren't alone in this. It wasn't just your peers. There was like a whole path that had been trodden by your fellow physicians and gastroenterologists. And so
Yes,
thank
you're
you.
not
Thank you.
alone.
Yeah, it's a really important thing for all of us to remember in mental health. And I appreciate you coming on and sharing so much wisdom. I look forward to knowing you and following your career. And everybody, please take this, use it for your mental health, use it for your mental fitness. If you have a lot of that, make sure and pass it on. And I hope something resonates with you and you take it into your life. Thanks again for joining us for another episode of the Dr. Drew Ramsey podcast. And I can't wait to see you next time. Please share this episode with someone who you know needs some inspiration around their gut, creativity, and a little extra artificial intelligence thrown in just, to make it a great modern episode. Austin, thanks so much. I'll see you soon.
Thanks, Drew.